Hi, everyone. My name is Lindsay, and I'm here with IHPS to interview Dr. Addison Cuneo, who is an assistant professor in the Department of Pediatrics. She specializes in pediatric gastroenterology, and her research focuses on medical traumatic stress in children with chronic illnesses such as inflammatory bowel disease, cystic fibrosis, and pancreatitis. Addison, thank you so much for joining me today. How are you doing?
I'm doing great. Thank you for having me.
Excellent. I'm so excited to learn a little bit more about what you're doing. So my first question is, what are you currently working on?
So, right now, I'm finishing the development of two new measures that are going to allow us for the first time to really identify which stressful medical experiences a child has gone through and assess what symptoms they still have ongoing of post-traumatic stress from those medical experiences. This is going to give us a few important things. One is it's going to allow us for the first time to be assessing kids in clinic and give us a reliable way to look for this. And then, secondly, it's going to help us to be able to develop an evidence base so that down the line we know who to help and when.
Mhm. That's amazing. I'm sure recognizing those children who need that extra attention is clearly the first step. So it's amazing that you guys are, targeting that first. And I'm curious how you got interested in that or why you're drawn to this type of research.
Yeah, as I got into medicine and my different training experiences, I found really early on that the things that were most interesting to me were the parts of medicine that were really at the nexus of medical complexity and psychosocial complexity. What I started to notice was that even when it seemed like kids were medically interesting, many of the doctors were mostly really interested just in the medical, the science side of it. And there's a
Mhm.
huge part that we know in gastroenterology that's the connection between the psychological and social sides of things, just like we know that the gut-brain axis and the social gut axis all have a deep interplay. And one of the things that I started to recognize was that particularly in our kids with chronic illnesses, when they came to us in different care settings, they were bringing with them symptoms that were from their past, from what they had gone through already with
Mhm.
providers before us. And what I started to recognize was that there was a potential for the whole system to do better and for us as individuals to do better by these kids, and hopefully to avoid some of the downstream effects that they have from symptoms that make them want to avoid coming to the doctor, and from responses that make them want to just disengage and separate from their care. Um, and so I got just really excited about this idea that if our healthcare system can be more trauma informed, if we can
Mhm.
prevent and address this, that we can make a really big difference for these kids with medically complex issues.
Yes, I'm sure that is such a meaningful target to have to, help these children who are already dealing with really difficult medical problems. And then exactly as you're saying, having these barriers to even receiving care, fears, or stress around that they could be avoided and make it easier for them to get help. Um, and so I'm wondering if you have any hope for how this work could help change healthcare or healthcare policy, if that's something that you're interested in.
Absolutely. I've been really interested in thinking about the fact that this post-traumatic stress that kids get from their medical experiences is something that happens from an entire system.
Mm.
And so we can train just doctors all we want, but then they're going to go down and get an ultrasound and have an interaction, or they're going to call their insurer and have an interaction that can be very difficult for them. And we
Mm.
identified early on that it's not just your MD medical provider,
Right.
but it's the overall experience of being a sick person in our society that really contributes to these post-traumatic stress symptoms. And so it's something that we can't only address one-on-one, that's going to be needed to be addressed in a very broad way through trauma-informed systems, including healthcare systems and all of the partners of healthcare systems that we work
Mm.
with. Our hope is that if we can integrate these trauma-informed practices into everyday pediatric subspecialty care, as well as into the experience of care in other domains, that we can really decrease patient symptoms and improve their outcomes over time.
Yes, definitely the identification of those systemic changes that need to happen and appreciating the fact that it's not these super specific changes that will really make the big difference. I think that you guys are really onto something amazing here. And I would also love to hear what's next for you and your team or what other projects you're interested in.
Yeah, thanks. So yeah, two things that are exciting that are coming up. One is, we really need to identify who needs support and when, at what point in their
Mm.
care trajectory and their developmental trajectory. And so we're hoping to follow people over time to be able to see how different risk factors for medical traumatic stress manifest and how we may be able to target specific moments most effectively. And then secondly, we're hoping to start instituting some of these changes at our systems level. So developing some concrete changes of things that we already know may help. One is we're hoping to pilot starting with some provider training because there's certainly work to be done there. And hoping to train some providers to be able to recognize the signs of medical traumatic stress, being able to respond in supportive and trauma-informed ways, and thinking about how we can integrate screening into our clinics as first steps.
Fabulous. Well, I'm so excited to see how the pilot goes and to hear the follow-up and where your work takes you in the future. So, Addison, thank you so much for sharing with us today and taking the time to talk a little bit more about your work. It was an absolute pleasure.
Thank you.